This is case L3 Ccta 102. The case history is a 52-year-old gentleman who has now had new onset chest pain. We begin with inspection of the study. Here at the base of the heart, aorta, pulmonary artery. The aorta appears to be of normal size. Moving down lower, the left atrial appendage appears to be intact. Left atrium appears to be of normal size. Thoracic aorta also appears to be of normal size. Quick review of the pericardium shows it to be thin and show no other major manifestations. We now look at the cardiac dynamics, looking at left ventricular size, shape, and function. Here is the horizontal long axis. Appears to be very normal to hyperdynamic function in the septum, apex, and lateral wall. There is a hint that there may be some element of left ventricular hypertrophy, at least of the septum, but we'll come back to that in a second. Here is the vertical long axis view, demonstrating again excellent function in the anterior wall, apex, and inferior wall. Finally, we turn to the short axis view, demonstrating normal right ventricular function and size, as well as normal to hyperdynamic left ventricular systolic function, normal in the septum, anterior wall, lateral wall, and inferior wall. We're now examining the end diastolic phase in the cardiac short axis. There's a question of whether or not there has been some hypertrophy of the septum. This is one of the views that we can use to make this measurement. If we look at the septum here to get an approximation of its thickness, we're getting on the order of 1.3 centimeters. If you check at the same level in the anterior wall, 8 millimeters. In the lateral wall, 8 to 9 millimeters. So there appears to be some mild to moderate left ventricular hypertrophy present specifically in the septum. We start reviewing the coronary arteries by looking at the left main coronary artery. This appears to be normal. There's no evidence of disease at any situation with respect to the left main. We now focus our attention on the left anterior descending. Here's the proximal segment. Appears to be essentially normal. However, as we approach the junction between the proximal and mid-LAD, we can see there is evidence of mixed eccentric plaque, calcified and non-calcified plaque involving the distal portion of the proximal LAD and the origin of the mid-LAD. This is sort of equivocal for obstructive disease. If you look at it in an MPR view, there's really no clear evidence that this particular lesion represents obstructive disease. However, in the adjacent diagonal branch, over here, we can rotate around, and this is of concern. There's a relatively long lesion in that vessel diagonal. You can see that there is some narrowing in the proximal segment with a normal caliber in the more distal segment. This is complex plaque, and this would be likely to be obstructive disease involving the first diagonal. We're now focusing on the left circumflex artery. The vessel appears to be non-dominant. Images are slightly noisy in these regions, but I see nothing to suggest any major disease. The vessel may be normal, although I cannot exclude some mild focal atherosclerotic disease. This is the right coronary. The ostium appears to be normal. The vessel grossly appears to be normal, although the images are noisy, and it is possible that there could be some mild focal atherosclerotic disease, but certainly nothing that suggests any major problems or complications within that region. The vessel appears to also be normal in the distal end, and very small posterior descending and posterior lateral branch, but nothing that suggests any clear evidence for focal disease. In summary then, we have a 52-year-old gentleman who's had a recent onset of chest pain. His left ventricular size and function is quite normal. He appears to have probably some element of mild to moderate hypertrophy involving the interventricular septum. Examination of the coronary disease shows some scattered plaque. However, there appears to be complex plaque in between the proximal and mid-LAD that is not obstructive. However, there is evidence of what appears to be obstructive disease and also complex or mixed plaque involving the first diagonal. The left circumflex and the right coronary arteries are grossly normal.